Hello, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes. And today we're going to talk about what do you do when a patient is not responding to herbs or pharmaceuticals. And this does happen. It's not common in my practice, but it does happen. And what you need to get used to doing is looking for the barriers to heal and then systematically removing them. Some of the barriers to heal can include things like trauma, abuse, heavy metals, mycotoxins, COVID, Epstein-Barr, secondary infections like chlamydia pneumonia, mycoplasma pneumonia, HHV6, cytomegalovirus, those kinds of things. And also unidentified co-infections. That is a huge one. And most often it's either Babesia or Bartonella that hasn't been identified. Now, the astute practitioner is going to be able to pick up, based on the patient's symptoms, usually what organisms are present. Sometimes I'm fooled, but as a sage now in my life and been doing this for 27 years, not really. I don't miss stuff very much. Of course, when I was younger and I was learning, I did, but now not so much. So it takes many years to perfect your craft, just like anything else. If you're an ice skater, a hockey player, a swimmer, a golfer, it takes years and years to perfect your craft. It's no different here. So you systematically remove the barriers to heal. They can also be hormones. They can be electromagnetic fields, so you got to get the EMFs out. Any of a myriad of things. And you systematically remove the barriers to heal, and then all of a sudden, the patient's body starts to respond to herbal treatments or antibiotics or both. Usually, most of my patients are on integrated, so they're on both, because I think that's what works the best. And I believe that once you remove all of the barriers to heal, 99% of the time, the patient will begin to walk a healing path. That doesn't mean there's not going to be bumps along the way, but they're going to be moving in the forward direction instead of staying stagnant or moving backwards. If you're staying stagnant or moving backwards, you really need to look at what's going on. Now, there are cases where patients take a little while to respond. And what I believe is going on is the immune system needs support. You need to open up the detox pathways, and you need to pierce the biofilm. A lot of these organs, the persister cells, live at the bottom of the biofilm, and they are very difficult to get at. And so you have to begin to whittle away at the biofilm, and then start to go after the organisms, and use sort of the art of war techniques to fool these organisms and stay ahead of them. So it is a form of strategic warfare. That's what I believe personally. That's the philosophy that I use when I'm trying to, get someone well. This is not a pacifying journey at all. There is nothing pacifying about this journey. It is a fight. It's a fight for survival, and it's a fight to heal, and a fight to stay well. So you want to remove the barriers to heal, which Dr. Horowitz talks about in his 16 MSIDS points. You systematically go through the list. You remove the barriers to heal. Another barrier to heal is issues going on with the microbiome in the mouth, cavitations, jaw, all that kind of stuff. And I just did a video on a friend of mine, Alex Volchanok, that is a biological dentist in New York, who I'm so thrilled to be working with, because I think he is going to be one of the missing pieces to some of my patients who are really struggling to move forward. So I hope you have found this information helpful, and I hope you have a wonderful day. Take care.